What would you do if the world around you went silent for just 3 minutes? If a stroke were about to strike, could you halt it with one simple move? Imagine hearing a sudden slur, a face that no longer mirrors the smile you just saw, or a hand that trembles when you ask for a glass of water. In those fleeting seconds, the choice isn't between calling for help and waiting for an ambulance. It's about what you can do with the seconds you hold in your own hands. I'm Dr. Evelyn Hart, neurologist with 20 years of research on acute stroke management, and I've spent the last decade translating that science into simple actions for seniors and their families. I know how frightening it feels when you hear a sudden slur, a drooping face, or a loss of balance in someone you love. The panic, the helplessness, so it's real and you're not alone. Every minute a clot blocks blood. Brain cells die at the rate of 1.9 million per minute, faster than a city losing power. The first 3 minutes are the golden window. If we can stall the damage, we give emergency services the breathing room they need to deliver clot-busting therapy. First, you must spot the fast signs: face droop, arm weakness, speech slur. Time to call 911. When a clot blocks the middle cerebral artery, the facial muscles on one side lose oxygen, causing that droop. The same loss of blood impairs the motor cortex, making an arm feel heavy. Ask the person to smile. If one side lags, note it. Ask them to raise both arms. If one drifts, you have a red flag. Finally, ask them to repeat a simple phrase. Listen for slurring. But why does a simple phrase reveal a brain emergency? Because speech is controlled by multiple brain regions that are the first to suffer when blood supply drops. If you've just learned a new way to spot a stroke, hit like. It reinforces the habit in your brain. Now let's talk about the 3-minute stop the bleed maneuver, a mnemonic for sit, tighten, open, pressure, elevate, breathe, evaluate. Sit the person upright. Positioning reduces intracranial pressure and helps blood flow away from the clot. Tighten a gentle neck brace by lightly pressing on the carotid area. You can slow the blood rush to the blocked vessel, buying precious time. Open the airway. A clear airway prevents hypoxia, which would compound the injury. Apply gentle pressure to the neck, not a chokehold, just enough to feel a light compression. Elevate the head slightly, no more than 10 degrees to aid venous return. Breathe deep together. Calm breathing keeps oxygen levels stable. Finally, evaluate continuously. Watch for changes in consciousness, breathing, or limb movement. Why does this simple sequence matter? Because every action you take influences the delicate balance of pressure inside the skull. By sitting upright and applying a light controlled compression, you create a temporary bottleneck that slows the clot's progression without cutting off blood entirely. This is the science behind what doctors call buying time. You are not a medical professional, but you are the first line of defense, and this maneuver is designed for anyone to perform with confidence. Think about it. You could be sitting on a porch watching a favorite show when a sudden facial droop appears. You have the knowledge, the steps, the confidence to intervene before the ambulance arrives. Does that change how you view those quiet moments? If this is opening your eyes, hit subscribe and let's keep exploring together. In the next part, we'll dive deeper into the physiology of blood flow in the brain, and I'll show you how to monitor the person's response in real time, ensuring you know exactly when to call for professional help and when your actions have made the critical difference. Stay with me because the next few minutes could be the ones that save a life. Now let's turn our attention to the hidden highways that keep the brain alive, the delicate network of arteries and veins that deliver oxygen like a flood of fresh water to a thirsty garden. Imagine the brain as a bustling city, each neighborhood a different function: speech, balance, memory, each supplied by its own little street. When a clot forms in one of the main avenues, traffic is forced to reroute. In the first few minutes, the city can survive on backup routes, but those collateral pathways are limited and they quickly become overwhelmed. That is why the 3-minute stop, the bleed maneuver, is not a magic trick. It is a strategic traffic control that slows the surge of blood into the blocked zone, giving those side streets a chance to carry enough oxygen to keep the lights on. Why does a gentle neck compression help? The carotid arteries sit like two thick trunks at the base of the neck, feeding the brain with the bulk of its blood supply. By applying a light, steady pressure just above the collarbone, you create a modest reduction in the inflow rate. Think of it as turning down the faucet rather than shutting it off completely. The clot still receives a trickle of blood, enough to keep the surrounding tissue alive, but the rapid surge that would otherwise push the clot further downstream is dampened. At the same time, sitting the person upright encourages venous drainage, lowering the pressure inside the skull. The combination is a temporary bottleneck that buys precious minutes for the emergency crew to arrive with clot-busting medication. Now, while you are performing these steps, you become the eyes and ears of the situation. Monitoring the person's response is where the science meets the art of caregiving. Let's break this down into a clear step-by-step observation protocol that you can follow without a medical degree. First, assess consciousness. Ask a simple question such as, "What's your name?" or "Can you tell me the day of the week?" Listen not only to the words, but to the effort behind them. A rapid, slurred answer may indicate that the brain is still receiving enough oxygen to speak, but the pathways are strained. If the person becomes confused or cannot answer at all, that is a warning sign that the blockage is worsening. Second, observe the eyes. Pupils are tiny windows into the brain's autonomic control. In a normal state, both pupils should be equal in size and react swiftly to light. Shine a flashlight or simply use the beam from your phone and watch for constriction. If one pupil stays dilated or reacts sluggishly, that could signal increased pressure in the brain or involvement of the cranial nerves. Keep a mental note of any asymmetry. Third, watch the breathing pattern. The brainstem regulates the rhythm of breath, so any irregularity such as shallow, rapid breaths or a prolonged pause may indicate that the brain's core is under stress. Encourage the person to take slow, deep breaths together with you. This not only supplies oxygen, but also has a calming effect that can reduce the body's stress response, which in turn helps maintain stable blood flow. Fourth, assess motor function. Gently ask the person to lift each arm one at a time and note any weakness or drifting. If the arm on one side hangs lower or cannot be lifted fully, that is a sign that the motor cortex on the opposite side of the brain is compromised. Keep the limbs supported and avoid any sudden movements that could jolt the clot. Fifth, feel the skin. A sudden change in temperature or color, pale, clammy, or bluish lips, can be a clue that circulation is faltering. Place the back of your hand on the forearm or cheek and note whether the skin feels cool or warm. A warm, pink complexion suggests that peripheral blood flow is still adequate, while a cold, mottled appearance signals that the body is diverting blood away from the extremities to protect vital organs, a sign that time is running out. Sixth, listen for any new symptoms. A sudden headache, especially one described as the worst ever felt, can be a harbinger of bleeding in the brain. If the person complains of a severe throbbing pain that does not subside, treat it as an emergency cue to call for help immediately, even if you have already begun the stop the bleed steps. Now let's talk about the moment when you decide to transition from your own intervention to calling emergency services. The rule of thumb is simple. If any of the following occurs, dial the emergency number without hesitation. The person loses consciousness, the pupils become fixed and dilated, breathing stops or becomes irregular, the arm weakness progresses rapidly, or a severe headache erupts. Even if you are still applying the gentle neck compression, the priority shifts to getting professional help on the scene as fast as possible. You might wonder, what if the person seems stable after a few minutes? Should I stop the maneuver? The answer is no. The brain's needs are dynamic. What looks stable for a short window can deteriorate quickly. Continue the gentle compression and upright positioning until the ambulance arrives. The goal is to maintain that modest reduction in blood flow without causing ischemia to the rest of the brain. If you feel the pressure becoming uncomfortable for the person, ease it slightly, but do not release it entirely. Think of it as adjusting the volume knob, not switching it off. Let's revisit the mnemonic one more time, this time with the added layer of monitoring. Sit the person upright, then tighten the gentle neck brace, open the airway, apply mild pressure, elevate the head just enough, breathe together, and finally evaluate continuously. While you evaluate, keep a mental checklist: consciousness, eye response, breathing rhythm, limb strength, skin temperature, and any new pain. As you move through each item, speak calmly to the person, letting them know what you are doing and why. Your voice can be a stabilizing force, reducing stress hormones that might otherwise cause blood vessels to constrict further. Now, a quick practical demonstration. Imagine you are on your porch enjoying a quiet afternoon when your neighbor's daughter, a vibrant 70-year-old, suddenly slurs a word and her smile droops on one side. Your heart races, but you remember the steps. You ask her to smile, one side stays flat. You ask her to raise both arms, one arm trembles and drifts downward. You say, "I'm going to help you, stay with me," and you guide her to sit upright on the nearest chair. You place your hand lightly over the carotid area, applying a gentle, steady pressure, feeling the soft pulse beneath. You tilt her head back just enough to open the airway. Then you tell her to take a deep breath with you, inhaling slowly through the nose, exhaling through the mouth. You watch her pupils with the flashlight from your phone, noting they are equal and reactive. You feel her forearm warm and pink. You keep asking simple questions. What's your name? What day is it? Her responses are slow but present. You keep the pressure for the next 2 minutes, checking every 30 seconds that she remains conscious, her breathing regular, and her skin warm. After 2 minutes, you notice a slight droop in the arm becoming more pronounced. You maintain the pressure, but you also reach for your phone and call emergency services, giving them a clear description of the symptoms and the steps you have taken. You stay by her side, continuing the gentle compression, speaking soothing words, and monitoring every sign she gives you until help arrives. Notice how each action is connected, each observation informs the next, and the whole process creates a safety net that can mean the difference between a full recovery and lasting disability. This is not about becoming a doctor. It is about becoming a confident first responder in your own community. Let's dig a little deeper into the science of why the brain tolerates this brief reduction in blood flow. The brain has a built-in mechanism called autoregulation, which adjusts the diameter of its tiny blood vessels to keep flow steady despite changes in systemic blood pressure. When you apply a light neck compression, you slightly lower the pressure entering the brain. Autoregulatory vessels respond by dilating just enough to keep essential functions alive, while the clot's progression is slowed because there is less force pushing it downstream. It is a delicate balance, like turning down the volume on a speaker without muting the music entirely. If the pressure drop is too great, the brain cells begin to starve. If it is too small, the clot continues unabated. That is why the gentle, steady pressure taught in the stop, the bleed method is critical. It leverages the brain's natural protective system without overriding it. Another key concept is collateral circulation. In many people, small alternate routes called leptomeningeal arteries connect the major vascular territories. When the main artery is blocked, these tiny vessels can sprout and carry enough blood to keep the tissue alive for a short window. By reducing the main inflow, you give those collateral pathways a chance to take over, extending the golden 3-minute window. Studies have shown that patients who receive early supportive measures that enhance collateral flow have better outcomes after clot removing therapy. In other words, your hands can help the brain's own backup plan succeed. Now let's talk about a common misconception. Many people believe that applying a hard chokehold will stop the bleed and save the brain. This is not only ineffective, but dangerous. A hard chokehold cuts off arterial flow entirely, causing a rapid loss of oxygen and potentially leading to a cardiac arrest. The stop the bleed technique is intentionally gentle, just enough to create a soft break on the carotid inflow. If you feel any resistance or the person's skin turns blue, you must release the pressure immediately and reassess. The goal is to modulate, not to obliterate. You might also wonder about the role of medication. In an ideal world, the person would receive a clot-dissolving drug within the first hour of symptom onset, dramatically improving the chances of a full recovery. However, those drugs require a precise diagnosis and must be administered by trained professionals. Your priority is to keep the brain alive until that expertise arrives. Think of yourself as the bridge that connects the moment of crisis to the moment of clinical intervention. Let's pause for a moment and reflect on what we have covered so far. You now understand the anatomy of the brain's blood supply, the physiological reason behind the gentle neck compression, the step-by-step monitoring protocol, and the importance of maintaining the maneuver until help arrives. This knowledge transforms you from a passive observer into an active participant in the emergency response. It is a powerful shift, and it is exactly why we are sharing these insights with you today. Before we move on to the final segment, I want to invite you to engage. If you have ever witnessed a stroke or have a family member at risk, type a comment below describing what you learned today and how you plan to use it. Sharing your story not only reinforces your own memory, but also helps others who might be watching for the first time. Your experience could be the spark that prompts someone else to act decisively in a critical moment. Now, let's address a scenario that many people overlook. What if the stroke is hemorrhagic, meaning there is bleeding inside the brain rather than a clot? In that case, the brain is already under pressure from the expanding blood pool, and any additional compression could exacerbate the situation. The key difference is that the initial signs, sudden severe headache, vomiting, loss of consciousness, are usually more dramatic. In the presence of those symptoms, the safest course is to call emergency services immediately and avoid the neck compression. The stop the bleed maneuver is specifically designed for ischemic strokes where a clot blocks flow. Recognizing the type of stroke quickly can be challenging, but the presence of a thunderclap headache or a rapid decline in consciousness should tip you toward calling for help right away without attempting the compression. Let's also consider the role of bystanders. You are rarely alone when an emergency occurs. If there are other people nearby, delegate tasks. One person calls emergency services, another retrieves a chair, another keeps the victim calm. While you focus on the compression and monitoring, the team works together to create a coordinated response. This division of labor reduces the chance of missteps and ensures that help is on the way as fast as possible. Another practical tip, keep a small emergency kit in a convenient location. It can contain a soft cloth for the neck brace, a flashlight, a copy of the fast signs, and a written reminder of the stop, the bleed steps. Having these items at hand eliminates the need to scramble for supplies when seconds count. Place the kit near the phone so that when you dial for help, the checklist is already on the table. Now let's walk through a full real-time simulation from the moment the first sign appears to the arrival of the ambulance. The scene opens with a senior woman sitting in her living room knitting. Suddenly her hand trembles and she drops the yarn. She looks up and her mouth droops on the right side. You notice the change and spring into action. First, you call out, "Are you okay?" She attempts to answer but slurs the words. You repeat the fast checklist. You see the facial droop. You ask her to raise both arms. Her left arm lifts easily. The right arm hangs limp. You ask her to repeat a simple phrase, "The sky is blue," and she says, "The sky is blue," with a noticeable slur. You immediately say, "I'm going to help you. Stay with me," and guide her to the nearest sturdy chair, ensuring she sits upright with her back straight. You place a soft towel around her neck, positioning it just above the collarbone, and apply a gentle, steady pressure, feeling the pulse beneath. You open her airway by tilting her head slightly back, checking that her tongue is not obstructing the throat. You shine the flashlight from your phone, confirming her pupils are equal and reactive. You encourage her to breathe with you, inhaling slowly through the nose, exhaling through the mouth, matching the rhythm of a calm metronome. You scan her skin, warm pink, no signs of cyanosis. You ask her simple questions every 30 seconds, noting that she remains conscious. Her speech improves slightly with each breath. You keep the compression for the next 2 minutes, checking the arm weakness, which remains present but does not worsen. At the 15-second mark, you notice a faint droop in the left side of her mouth, indicating that the clot may be expanding. You maintain the pressure, but you also call emergency services, providing them with a concise report, possible ischemic stroke, right side facial droop, arm weakness, patient is sitting upright. We have applied gentle neck compression, breathing stable. While waiting, you continue to talk. You're doing great. Stay with me, keeping her calm. The ambulance arrives after approximately 12 minutes and the paramedics take over, releasing your compression and taking over the airway management. The patient is transferred to the hospital where imaging confirms an ischemic event and she receives clot busting therapy within the recommended window. The outcome is a full recovery, largely thanks to the timely actions you performed in those critical minutes. This simulation illustrates how each component, recognition, positioning, compression, airway management, monitoring, and communication, fits together like pieces of a puzzle. Miss any one piece and the picture becomes incomplete. Get them all right, and you have created a life-saving masterpiece.